Good morning, friends. Welcome to the Dr. Niraj show. Today, we are coming up with a fantastic program. It is once in a lifetime kind of program for all of us. Dr. Ali Irani sir will be with us. Uh, I would like to give a short introduction of Dr. Ali Irani, because if I will start giving the major introduction, then it will take an hours together. Dr. Ali Irani is a second name of physiotherapy as far as India is concerned, and he is our uh, proud as far as physiotherapy field is concerned. Friends, Dr. Ali Irani's qualification is Bachelor of Physiotherapy. He has done from MS University, Baroda, PhD in Sports Medicine. He has done double PhD. Another PhD is done in Anatomy of Body Movement and Dance, Bombay University, and he has done Doctor of Physiotherapy from NUMS, Spain. Right now, sir is designating a post of head of the department Physiotherapy and Sports Medicine and Rehabilitation Center, Nanavati Super Speciality Hospital, Mumbai. He is a chairperson of International Affair Indian Association of Physiotherapists and principal at NMIMS University. He is having a vast experience. The major experience, we must say, and we all know, is about the Indian cricket team. I think he is the physiotherapist who served for maximum year to a single international cricket team. And he served for Indian cricket team for 12 years. That is a very, very big period. He is a member of Board of Studies in NMIMS University. He has worked as researcher at Bombay Hospital uh, uh, from 1985 to 86. He has presented papers on knee mobility, backache, hammer toe for frozen shoulder. Friends, hammer toe is a technique he and Dr. Rambai has found. It is a fantastic technique, and it's an innovation in our field. It releases the fascia, and they have made a special kind of equipments for that. It is a beautiful technique. Um, uh, he has done presented papers on fitness and sports injuries and held workshops on innovation physiotherapy and sports medicine at various national and international conferences. At various physiotherapy and medical colleges, he has given many lectures and many workshops he has conducted. He has conducted a workshop for Iranian Physiotherapy Association in 2004 and again in February 2005. And he has done physiotherapy setup after a major earthquake in Gujarat. And recently also he has done great work to re-establish the physiotherapy centers at the various parts of the India where there were earthquakes. So he is playing a major role for that. Um He is examiner and lecturer for students of Masters of Fine Arts Dance at Bombay University. He is a PhD guide at various universities in India, and he takes lectures on disaster management along holding the rural physiotherapy camps, community-based rehabilitation. Uh, he is awarded so many awards throughout his career. I would like to name a few. One is the Hitra Oration Award, that is he received in 1994 for achievements made in the field of physiotherapy. He is awarded Lifetime Achievement Award by Indian Association of Physiotherapists in 2004. He is awarded Fellowship by Indian Association of Sports Medicine in 2005. He is awarded Fellowship by Indian Association of Physiotherapists 2005. Best Citizen of India award he received in 2011, and Best Physiotherapist award he received in India from MedSpace in 2014. Fantastic achievement, sir. And he is a patron member of Indian Association of Physiotherapists. He is a life member of Indian Association of Sports Medicine. He is a vice president of Bombay District Sports Medicine Association. He is a vice president of Bombay Suburban Amateur Athletic Association. He is a member of Gujrat Physiotherapy Council and Maharashtra OTPT Council. Uh, fantastic, sir. It is our proud privilege that you are with us and you are attending our show. It is definitely a proud moment for us.
बोलिए. ठीक. मैं डिटेल भेजता हूँ, सब वापस भेजता हूँ.
Good morning, sir. Good morning, sir. Friends, there are some technical issue. Good morning, sir. Can you listen to us, Dr. Ali, sir? There are some technical issues. Ali sir will be with us in a very short time. Just wait for a second.
हेलो, अभी आ रहा है आवाज? हेलो, मॉर्निंग.
Good morning, sir. Welcome to our show.
Thank you.
Thank you,
Can
sir.
I just
Thanks for joining us.
Presentation, just see. Are you seeing it on the screen, the presentation?
Yes, yes, it is visible. So you can start your presentation, sir. Yeah.
Fine. So I can start now. I go.
Yes, sir. Please, sir.
Okay. Just give me 1 second. I'm just putting my phone. I just give my phone for others to. Wow. That. Put it on silent. Good morning, everybody. Ali Irani from Amchi, Mumbai. I hope, especially those who are from Gujarat, hearing about the cyclone coming and more area of Palghar, Navsari areas to be disturbed. Hope you all are safe and remain safe. Charge up your mobiles, charge up your backends, whatever you have been doing, your laptops, because they say, already Mumbai is saying the electricity will go. Our today's topic is sports medicine and what is the recent trend. We have heard a lot, people talk a lot about sports, but I have put it in the whole sports in a nutshell for especially keeping physiotherapists in mind. The physiotherapist should know, we all know how to evaluate a patient, we all know how to give diathermy and ultrasound. But my main aim today is to teach the physiotherapists here how you are going to prevent. Because being in sports, it's not only treatment, but if we can guide and train our sportsmen in such a way, they could avoid that type of injury, which we are sure. I believe whatever is on the screen now, we are going to come to this world only once, and what we do shall remain with us. So, our topic is recent trends in sports medicine. I work for Nanavati Hospital, Mumbai, and we have a sports medicine center. We cover up most of the sports for our MPT students and interns, those who come here from Gujarat. We keep sending them to all the sports that's happening in Mumbai. You have to understand sports. Why does a person become a sportsman? To bring laurel to the country, to win a gold medal, to win the World Cup. These are the aim. Basically, aim is to reach there, to bring honors. That's the passion of a sportsman. So we have to understand that sports has become a profession now. So if sports is a profession, then we have to understand it requires peak fitness. You have to always be fit. Whenever you are called, you have to jump and you have to win for the country. With optimum confidence, your confidence has always to be high because sports is competition. Sports, playing for the country, playing for the club, playing for the states, playing for your district is not for fun. It also means you have to win, right? You have to win. So because winning comes, it's a competition. And because of the competition, there is a constant pressure on the sportsman. And there's always a fear of failure. You always think, what if I don't perform? I'll be out of the team. Nobody wants me. My company will remove. My advertisements will go away. So that fear of failure keeps harassing the sports people. So in short, what are the qualities of sportsmen? So you have to understand they're highly strung. They don't like when something is told to them that they're not playing well or they're not doing well. They are always under tension. I told you the reasons. They're unreasonable. So if you try to tell them, they will be asking a lot of questions which not be reasonable, possible for you to answer. They dislike rest. You cannot tell them completely, you have to take a complete bed rest. Suppose if their ankle is injured, you have to ask them to do the upper extremity. If the upper extremity is injured, you should be able to say that you can go for a jog. You can do a lot of things there. And never tell a sportsman you will never play a game. They will not like it. They'll refuse to even know you or come back to you. Always say, okay, you will come back, you'll be better, we are going to train you, we are going to rehab you. You have to keep encouraging word, but never tell a sportsman, okay, you will never get back to this game. So what is the role of a physiotherapist? The role of a physiotherapist is not only to treat injuries, but also to achieve the maximum level what that sportsman can do. And today, prime focus is going on prevention. So I'm going to open this word prevention for you all, and the whole sports medicine will come in this word of prevention. Very simple. You can come to know P is for peak fitness, R is going to be regular training, evaluation specific to the sports, vision, endurance, nutrition, technique, injury, overtraining, and last is doping, no to drugs. So I'm going to open up everything, right? And we will go ahead. What is sports medicine? What is the recent trend? What is required today for people who are into sports medicine? I feel is prevention. P is for peak fitness. Fitness is a dynamic state of a body that can be defined as a maximum level of work that an individual is able to perform. So whatever maximum, the best timing you can give in running, the best game that you could play in your bowling, or the best bowling, the best batsman, the best hitting the goal, whatever. In that particular sport, the best you can achieve is called peak fitness. You are at a peak fitness. Now, there are two types of fitness in sports. Sorry. We'll divide the fitness in sports into two: general fitness and it's jumping. Okay. Specific general fitness and sports specific. I'm going to open both. So, what is general fitness? To remain in peak fitness, you need to have the right body composition. Right body composition defines vitamin B12, D3, your ESR, hemoglobin level, everything comes in the blood test here. Then you have to have the endurance, both cardiovascular and muscular endurance, good flexibility and coordination, good strength, whichever sports you are performing. Combination of all gets you into peak fitness. The other one is a sports specific. I need to make you all understand. Every sports has a general fitness and sports specific fitness. So let us talk about football first. So you'll see in football, we have a defender who stands behind and helps the goalkeeper so not to allow the ball enter the goal. We have a goalkeeper who's around the goal. He doesn't go forward. So his running distance is 20-25 meters. Similarly, the defender is around 20-25 meters, but a striker may take the ball for 70 meters and it's shot back. He'll come back again, maybe 70 meters, 80 meters, 50 meters. He comes back again. He shoots to the next player. He runs again. So the endurance of a striker is much more because he has to go through and forth. He keeps running in between. So he has to have that speed also, where a defender will only defend the ball and his power has to be good enough to pass the ball to the forward or the strikers. So there is a sports specific training for them. The goalkeeper's training, of course, is again a little different because you will have to have more agility and flexibility. In athletic, the best is going to be the runners. We have a 100 meters runner and we have a marathon runner. So the training cannot be same. 100 meters will just jump. He has to have a spurt of movement, which will be immediately running 100 meters, and he wants to do it in 12 seconds or 11.5 seconds. At least where Indians are concerned. But we have 9.98 also done by the Olympic runners. Now, a runner of 100 meters won't be training for a marathon, which is 42 kilometers. And a 42 kilometers marathon runner won't be training for speed. He is training for endurance. So I want you to understand that two things. Similarly, a thrower, the hammer throw, he has to swing, right? The whole, both the arms, but a discus throw, it's one shoulder, right? So the training, the muscles are different, the training is different. Coming to cricket, which all of us are seeing. So the training of a batsman, he has to run between the wickets. So he has to train for that 17 yards, going and coming. Bowlers again divide. A spinner will take 4 or 5 steps and bowl. But a fast bowler takes 15 meters run up to bowl. So they have to have that extra training for running up. So sports specific fitness comes after general fitness. After your sportsmen are generally fit, good strength, good flexibility, and you are seeing their body composition, all your parameters you are checking, then comes what role they play, which sports. So is it football, hockey, decide. Then again in that sports, what is their role in that? Are they a fast bowler? Are they a spinner? Are they a wicket keeper? Wicket keeper also requires a lot of knee bending, coming up, good quads, good flexibility because they have to jump and take the catches. So this is how we say, okay, specific to the sports, they have a training. Now, what affects the peak fitness? Usually we have seen most of the sportsmen, because they become famous, people are watching them on television, on mobiles. So there are a lot of takers, many people, or with contact with friends, they fall in love very easily. From the girl's side, it is they've fallen in love with the star, not with the person. So usually what happens, okay, because they've fallen in love with a star, so by the time they know each other and all that, a little later they realize It was not the person. As a person, he may be not be good, or as a person is very good, but his games are very bad, or vice versa. And then the other thing what we look is undue pressure which keeps coming. What affects? Again, what affects a peak fitness? There's the pressure from the parents. Are, I wanted to be a doctor, you wanted to go to sports, now you are not playing well. Who will, what job you will get, how much you will earn now that you are not in the playing for the country, all that thing starts. The coach says, I've done so much of effort. See, anybody after you, so many people from my coaching are playing for the country, but you are not doing well. There's a pressure. Media, that is press, they write a star is born. And suddenly when you don't perform, they start, writing about you, writing against you, cutting you down. So there is a lot of this pressure that comes, and that affects the peak fitness of a sportsman. R is for regular training. Here I want to emphasize and make you all understand, again, those who are physios, a sportsman has got 2 seasons. It's during the season and they're off season. Now most of the sports are off season. Okay. So imagine all the sportsmen sitting at home, they eat very well, eating the same food, eating very well. So you all know 7,000 calories 1 kg, and a sportsman can eat very easily 5,000 calories or 4,000 calories in a day. Each meal can be 2,000 calories. They eat very well. But if they are not practicing, every day they were practicing, they were going for their training, so they were burning that calorie. Now, because the burning is not same, we have to tell them to be a little careful about the diet. That's one. And off season, I'm not talking about Corona, so they can't go to the gym, they can't go to the ground. But otherwise, off season is they have to go to a gym or run, do the running, endurance training, flexibility training, or strength training. They can go to the gym or do the band exercise at home. And once a week, they will do the game that they play. They should play the game that they play. And last 1 day is complete rest. Any day they can select, it should be complete rest. Now, during the season, what happens when they're playing for the country during the season? Every day they are practicing, and they're practicing for the perfect skill to be better batsman, better bowler, better fielder. So they're practicing only the skill. So 5 days a week, warming up, you warm up, you stretch, and you are playing with your techniques, right? But once a week, go to your gym, work on your endurance, go for a long run, go for strengthening, go for swimming, right? And again, 1 day complete rest. So you see it in red, both the days, both the seasons. During the season and off season, I'm showing 1 day complete rest. Now the problem with most of our sportsmen are that 1 day complete rest they don't take. Either their team is flying from one city to another city, or they're advertising for their shooting, or they have social commitments. They have to go for dinner, they have to go to somebody's house, right? Or they are playing in the building, they want to knock in the building. No. For me, complete 1 day complete rest is have your breakfast, lunch at home, even on your bed will do. Or maximum walk out from your bedroom, go to your hall, your dinner table, have there. Don't commit anything. No playing, no walking, no running, no socializing. Socialize being at home, meeting your friends at home. This is off season. Sorry, it is that 1 day rest. And yeah, going out and meeting friends and socializing is out of the picture now. I don't know for how long we are going to be on that, but we are very hopeful that within next 3 to 4 weeks we'll be okay doing our practice and things. So you have understood 2 seasons. First, when a sportsman come to you, you have to ask them whether you are in your season or you're off season. During the season, okay, you are playing. What are the training that they have been doing? Off season, please warn them. Now, same thing happens when the player is injured. When the player is injured, also you should understand the player is off is going to come to you for 1 week, 8 days, or 10 days for treatment. Warn them about the diet because they are not practicing, so they're not burning the calories through practice. So it's very important that they are careful about the diet, eat a little less so that they don't put on weight. Usually, I have seen it, most of the players after the injuries, they come back with 2 or 3 kgs excess weight because they were eating the same food. They were, the same quantity they were eating, but they were not burning it. Just taking care of the physical conditioning. If you look at it, a sportsman should always be careful and keep checking the strength, power, agility, flexibility, speed, endurance, balance, reaction, reflexes. If you are the physio for a sportsman, keep asking these questions and check whether they are into all this or not. So in short, I always say keep your engine tuned. You should be ready. Suddenly, if you are called, you should be ready. You should be agile. Coming to the sport-specific training. Again, two types, sport-specific, age-specific. I'll come to the sports first. I'm giving you 3 examples. A weightlifter can lift, suppose 200 kgs. He requires strength. He puts it down. He won't be able to lift immediately again. He requires that 15-20 minutes rest. A gymnast will require more flexibility, but a cricketer, footballer, hockey player requires more skill and coordination, good endurance. Right? So see, each game is different. Another example, you all have seen the WWF wrestlers, right? Huge. Any of y'all can just slap them and run away. They can't catch you. Slap a WWF wrestler and run away. He will never get up to catch you because it takes time for him to get up. He has a lot of strength. He has no endurance. He has no flexibility. But if he catches you, nobody can save you. He has a lot of static strength. Getting it? So each sports has a different training. They are trained differently. Their nutrition is different. Their intake of food is different depending what they are doing. A major question coming from the parents or maybe tomorrow to you is when to join sports. Biggest question of parents and biggest question you would be facing very soon whenever you get into sports. So I've drawn this triangle for them. So up to the age of 12, I tell, just play any game. Let your child play any game. Let them awaken interest in all the games, whether they want football, cricket, golf, hockey, whatever they want, swimming, let them do it. It's between 12 and 14 that they decide what they like. So, they've got matured enough and then they have tried all sports and they feel they are much comfortable and better in that specific sports. So between 12 and 14, when the child shows interest in specific sports, so a good coach has to come in. Good coaching comes in, selection of sport is done, work on the skill, correct technique that the coach will be explaining them, and gradual weight training comes in. Between 15 and 19, they are playing for the country or they're playing for the club, they're playing for the university, they're playing for the college. They are professional. So weight training continues, specific training to work a little more if any of the muscles are weaker. And they should remain in peak fitness, always. That's the time. And once they cross 19, they are a champion, they are a professional. So they have to do high intensity training to keep their best performance. People have realized their performance, it should not fall. So it should go higher or at least remain stagnant there. This is a simple slide to explain when to join sports. So up to the age of 12 or 13, don't ask the child what you want to play. Allow them to do anything. And age-specific training, people say that small children should not do weight training. No. It's proved wrong. Statistic and science has shown low resistance and high repetition are proved to be more beneficial to children. So they do less weight but more repetition. It has helped them. Keys for evaluation. So I have to speed up a little. We have only 1 hour, right, Niraj? Are we only on 1 hour? So what is the right evaluation?
So you can take your own time.
Fine. So we have to always evaluate the general health. General health is ask the sportsmen when they had done the last blood test, whether they have any history of fever, whether any aches and pain anywhere, whether you will be seeing the ranges also. Uh, Ask them about the training history, how much they train, how many hours they train, and how many times a day. Some of them do it twice a day. Previous history, whether they have any injuries earlier, whether they had any malaria or anything earlier, predisposing factor, what causes the pain. I mean, predisposing factor, I'll tell you a very simple thing. You have players, whenever they see humidity, like Bombay has high humidity, Chennai has high humidity. So whenever they play there, they start getting cramps. So you have to be careful about that sportsman, okay, to hydrate that sportsman more, because you should know, okay, this. So what? Why we call it predisposing factor? What causes that? So maybe one of it is humidity. Other way around, cold climate, somebody can't, freezes. So will require more of warming up for that person. Then there are psychological factors involved, like maybe a love break or stress from the press or press writing against that person. A lot of psychological factors are there. You have to evaluate the technique, whether they change the technique. I'll be talking about it in a later slide also. Always examine the normal side, compare the normal side also. Assess any referred pain. So when they see there's a pain in the neck, ask whether the pain is coming down to the hand. A pain in the leg, whether it is from the back, or they complain of back problem, whether it's coming down behind the leg. So we'll come to know whether it is L5, S1, whether it is L4, L5, depending on the where they complain of the radiating pain, we can know where the site is, where the root of the pain is. Nutrition, very important. I said if they are injured, reduce it, what they are having. There's going to be another slide on nutrition also. I'll explain more about it. And what did they do for work and leisure? So whether they are working, so how? Some of them say, okay, the leisure is seeing the games they have played again. So it's becoming stale for them. So you have to change it. So I always say for work and leisure, they should play another game. If they are a footballer, they should play cricket. If they are a cricketer, they play football or tennis or squash. They should divert their attention into, or watching, even watching television. They are a cricketer, they should not watch cricket again. They should watch football, they should watch tennis. So they should divert their mind, not focus only on one game to be stale. Investigation has no substitute. So please understand, whenever a player is injured, especially those who are playing for the state or the country, because of the media, see that full investigation is done. If they require an MRI, do it. If they require an X-ray, do it. If they require a sonography, do it. If they require a blood test, do it. If they require a CT scan, do it. Because you need to be sure when you say what is wrong with the sports person or what is wrong with the athlete. So investigate. It's very important. Don't assume. No. Investigate. From prevention, the next one is V, which is vision. I said earlier, the vision usually is to win the World Cup or a gold medal. Now, what hampers this vision? This is an example of a cricketer. I remember very well when I had gone to see him on the ground. He was asking that my girlfriend is sitting in green t-shirt on the spectators, just take care of him, see that she's comfortable or not. Almost 700-800 meters away. And when the game started, next ball, he got out. So there was a question. You could see her 800 meters away and you could not see a ball which is coming just from 15 meters away, right? So they should know that they are playing for the country and they should not divert their attention or be focused. I always also say that when you lose everything, right? When you lose and you lose a game, you lose everything. Your advertisement goes away. And I always say success has many fathers. Failure is an orphan. When you don't perform well, nobody wants to own you. But when you are famous, everybody will say, oh, I have coached him. Oh, I have treated him. All that thing starts. So keeping all this in mind, a sportsman should be focused and play for the country. The two types of endurance, I won't be talking much about it. Cardiovascular is tested by Bruce protocol and the RM test for the muscular. Can evaluate them. Till now, everybody said that high protein is the best choice of energy. It's proved it's a myth. Like your fuel when you are playing is carbohydrate. Right? So, what should be an ideal meal for a sportsman? It should 70% should be carbohydrate, 20% protein, and 10% fat. Which those who are non-veg, it directly comes from the non-veg food, and those who are veg, it's coming from the ghee, the butter, cheese, milk, whatever they are having, it's come from that. Differences between the two diets. A protein diet elevates the resting metabolic rate. More energy is required to burn the proteins. Whereas carbohydrate is the main fuel. It is the fuel that when you are exercising or playing, it's the fuel, main source of energy, whether you're doing aerobic or anaerobic activities, aerobic or anaerobic, whichever you do, it requires carbohydrate. Question arises always, what should be the pre-competition meal, right? So hydration starts 2 hours before. Keep hydrating yourself. Depending, again, it also depends on especially you are in a humid area or the climate is going to be 30 plus, so you require good hydration. See, in a simple way to explain you all, thirst is a signal that the body requires fluid. Simple. So whenever a sportsman is thirsty, it's not that he should not drink water. Drink water because a signal has come. You're thirsty, drink water. Right? And once you have finished the game, again, you should hydrate yourself after the activity is over. So you will run better on the right fuel. So the right fuel for the competition is good carbohydrate and hydrate yourself with water. Good practice makes a good sportsman or sports person, but practicing the perfect techniques makes him a champion. Right? So they should know whichever technique they have been good, they have to keep practicing that to remain a champion. So physiotherapists should regularly evaluate the sports person for the strength and flexibility. Change of technique should be done off season only, not during the season. No technique should be changed. We had a weightlifter for India, and there was a competition in Canada, and she was going to win a silver medal. The coach was sure. But just one day before the performance, asked her to change. If you change your technique and you can lift a little more, and you may get a gold medal. But the change of technique caused a shoulder dislocation. She could not get silver also, she could not get bronze also. So always, even whether it's a fast bowler, batsman, whatever, they should change. If they want to change a technique, or if the coach says, if the coach wants them to change something, it should be off season, right? Not during when they're on the peak or they're playing for the country. A simple example of throw. Next time you are seeing a fielder throwing from the boundary line, if you see the chest, the throw will be right. But if you see the shoulder, the throw won't be right because it requires that lumbar rotation. If they don't do it, the throw doesn't go exactly to the right spot. We are going to come to injuries now. Eyes for injuries. I'm going to open up all these causes. So I'll straight go to the causes. India has such poor grounds. So one of the reasons why we get injured, you see the pebbles all around, and we have national players practicing there. Then we play at such grounds also. So where will be the focus of the players? They're more bothered not to bang at the tree, right? So again, that we have to remove all small faults, but I'm sure this tree cannot be removed because the environment NGOs won't allow you. So either you have to shift the ground or be ready to play with such conditions. We used to always say wear proper socks with your shoes. This was a test when we were selecting sports people for Maharashtra, right? In one of the ground of SRP ground of Mumbai, Goregaon. Right? Forget asking them to wear socks. They were without shoes, but they had lovely talents, right? So you would be surprised that one running without shoes could win against the one wearing with shoes. Every sports has its own shoe. You cannot play football with cricket shoes. You cannot play cricket with hockey shoes, and you cannot play, squash with tennis shoes, and you cannot play tennis with cricket shoes. So every shoe has its own. Every sports has its own shoe. I always look the wear and tear of the shoe whenever a sportsman comes to me, especially with the ankle, knee, or back problem. I want to see the shoes because most of the sportsmen are superstitious. They will keep playing with the same sole, same shoe because they have been winning or they feel they are, it's lucky for them. But maybe it has worn out from one side or the foot side. So very important to look at the footwear of a sportsman. Insufficient warm up again is the cause of injury. Insufficient warm up and then stretching. People stretch directly, not good. Even a car or a scooter, when you start, you raise it for some time. You raise it, or the car, you raise it. Why? You want all the oil to go in all the pistons before you pick up and go. Similarly, in every sports, you have to warm up before you stretch, right? So a good warming up is important. I call it the dirty dozen. This exercises or this stretching has to be done after evaluation by a physiotherapist, right? It should be avoided till you have not examined them or done the evaluation for this exercise. Incorrect sports kit. We are into many games have the grip, like hockey, cricket, tennis, squash, polo. They all have a grip. So usually we have to find out what is the right grip and two, the right kit. Here you will see this player on the left side. Because the visor was down, the ball hit his nose. It has happened in Indian cricket. The visor has to be in such a way that the ball does not enter the visor and the helmet. But most of the batsmen bring it lower because they could see the ball better when the bowler is bowling. The rod comes in between. Because they reduce it, if the ball hits, it hits the nose. So again, it's a job of a physiotherapist to check every helmet and visor before the player goes in. He has a ball which he sees that it should not enter. Similarly, in hockey, you have to see the shin guard, right? In cricket, facing fast bowler, elbow guard, chest guard, you have to wear it. It's your responsibility. This is again prevention. You are seeing that they should not be injured. Now I come to the next one. Everybody asks that question, what should be the grip? Very important. So mid palm align to the tip of the middle finger. This. Measure this. So the grip should be that, including your car grip. When your steering is, you're holding a steering, sometimes people put a lot of things on it, fancy things, so it becomes too thick. No, the right grip always should be mid palm aligned to mid of your finger and measure. So when a sportsman come to you with a golfer's elbow or tennis elbow, always measure the grip. Tell them get the racket or get the bat, measure. You have to just measure the girth and see whether it fits into either it is more or less. Both can give you a problem there. So the right grip is important. Other type of injuries are because of sports, type of sports, right? So you see rugby, I call rugby is no more a game, it's a knee disease. Because rule of the game is one has to dash into the knee of the opponent, right? So it goes in subluxation. Multiple injuries, it will be meniscus, it will be ACL and PCL both tear or only ACL tear, right? And there's a lot of injuries. Collateral ligaments get strained or even tear. Now, boxing, again, the rule of the game shows unless you don't bang and the guy doesn't fall, you don't win. Right? So some games, certain injuries are part of the game. You have to bang him so that he falls down. Now, what are the strategies of prevention? The injuries. We have been talking only about prevention, right? So this two type, which is very common, we have to look at it, is intrinsic prevention. Avoid training or playing when injured. Once you're injured, avoid. Pain means is a signal something is wrong somewhere. Thirst is a signal that your body requires fluids. So pain is a signal something is wrong somewhere. Stop. Then see to it in intrinsic training that proper warming up and cool down. Even half of the time should be given for cooling down. Suppose you're warming up for half an hour, 15 minutes should be cooling down. And the weekly rest, check whether it is doing that. Now, how to prevent against strategies may in the extrinsic environmental condition, I said, it depends. If you're playing at a humid climate, you don't do over warming because your body is losing water. You get dehydrated, right? And like you're playing in Srinagar, it's very cold. So I asked the boys to have a hot shower before they come. So it's called passive warm up. You warm up yourself passively, then come and instead of running 2 rounds, we run 3 rounds or 4 rounds to warm up well, then stretch. Then sports specific equipment. I said about the shoes, similarly equipment with the right grip, whether everything was right. You should not be using your old thing thinking it is lucky you are winning because of that racket or that bat. No, it should be proper. So avoid harmful things. So if you see harm, avoid heat. People immediately put hot water and all that. No, it should be ice first. Avoid alcohol because many friends give you, arey darad bhul jayega, you will forget the pain. Laga lo, right? Rubbing again will increase the injury till you don't know what it is. Till it is not investigated, don't rub. And movements, don't move it till you are not sure, right? So suddenly, these are the harmful things. You should not be doing it on the sports. Now, most of the sportsmen overtrain because they're not performing well. They train more. If your training was 2 hours, they make it 4 hours. If it was one time morning, they make it morning and evening. They train twice. So what happens? Staleness occurs, right? So when the training program exceeds your body physiological what limits it can take, when you do it more than that, no, the body also refuses. I'm not going to listen to you, right? So what you are going to do, it's called overtraining syndrome. Physiotherapists have a very important role in it, right? Overtraining syndrome. So what are the effects of overtraining? I would straight go to the last one and look at the last one, sleep disturbances. If the player says, I cannot sleep well, rest, you can then go and find out. It affects the performance, it decreases the speed, decreases endurance, decreases the strength, decreases heart rate recovery time, and poor concentration, decreased muscle growth in performance. Physiologically, increased heart rate. The heart rate increases, increased fluid loss, chronic muscle soreness, frequent injuries. Psychologically, fatigue, depression, restless, lack of confidence, sleep. So ask the last one, rest all, you should be sure it will be. Now, how to treat them? What are you going to do to them? Increase the water intake, good hydration, and increase their sleep. If they're sleeping for 8 hours, make it 10 hours. They're sleeping for 10 hours, make it 12 hours. Increase their sleep. Proper stretching and cool down. Interval, take the program. No, you're not going to train so much. You're going to do it only once. Only this much. Reduce the training and then increase again gradually. Right? Don't allow them to overtrain. You program them again. Right? Wow. Last one is no to drugs. We call it doping. Right? Now, banned drugs usually fools the performance of a sportsman. They take it not knowingly or knowingly also, right? And that's why most of the Indian sportsmen do it during the camps. And when they go to perform, because they can't, there's a test going on there, they don't perform. Then the blame goes on the bad food. You are vegetarian, you are not getting this, you are not getting that. All the blame game comes, right? So now the banned drugs in any form taken. The simplest one is the cough syrup, not allowed. Right? In any form. Some take it in injection form, some take things which, patches are available. They put it in patch, some take it as a herbal drink, whatever form, capsule, tablets, whatever. Whichever form you take, right? It's an unfair manner. So there is going to be a ban on you. It will be found out, right? So what is doping? Or we have to say no to drugs. because what is banned is banned. Every year a new list comes from the Olympic Committee, but sportsmen in that year find out something new. So a new come, by next time they come, so at least 1 year they succeed doing whatever they want to. See, the currently banned drugs are all this, and they're all banned. It increases the performance of a sportsman, but it's banned. We have started brain mapping in sports. Last 8 years, I've been doing the study on brain mapping. So usually the left side, I would say it's a male's brain. It's like a box. They only do whatever they require to. And the right side is a female brain. They can do multitasking. See, so many things they can do at one time. Hopefully, just our study showed the sportsmen, when they performed their best, they were in alpha zone, that was 8 to 12 hertz. 8 to 12 frequency per second is called hertz. 8 to 12 hertz. Delta is almost you are asleep, theta, you are semi coming up, right? Alpha is the best, you are focused, alert. And beta and gamma especially is a lot of confusion. So whenever we have seen players not performing well, it's a very simple device. We put we have a we do an EEG with the frontal lobe. Just there are buttons there on the forehead. We attach it to the portable EEG and back to the laptop. So when we ask the sportsmen to think the best game they've ever played, and they were very happy. So we have found them in alpha, 8 to 12 hertz. And when it's the worst, the most ganda game you have ever played, you were not happy that you have played. So they were in gamma. So we did this test on young boys and girls from college. So when we told them that you are enjoying with your friends, so they were in alpha, right? And when we said exams, they came to gamma. So gamma is almost 30 to 40 frequencies per second your brain works. So it's confused, anxiety, a lot of things, disturbances. So this is what we have found out, and hopefully it's going to be very beneficial if we can get the sportsman into alpha zone. It's going to be a new trend which will be coming in. This is how the slide looks. It's a slide. I was trying to get, if I have the video. This is how the slide will look. Patient being in alpha. The sportsman is in alpha. So what does alpha do? Healing, positive thinking, right? Awareness and enhance focus. Your focus. See the slide. So almost 8 to 12, 8 to 12, and here it is gamma. The other end, what you see is gamma. Oh, I hope to show you the gamma one also. Yeah, see, that's beta. Still not gamma, but beta. It's a mix, right? And it's going to be anywhere from 14 to 25, 26 hertz per second will be beta. High complex mental functioning, anxiety, hypertension. So last one should be gamma zone, too many thoughts. Seen in anxiety. So you can look down there, right? This is how it works. Person cannot focus. And that's why our main thing is to start getting the sportsmen into alpha to perform. I'm on a Zoom call. I'm on a Zoom call. Sorry. Okay, that's gamma. Again, a chart to show you all. See delta, density, survival, deep sleep, comma. Theta is, if you're going to see emotion, feeling, trance, just coming out, dreams. Alpha is relax, integration of feeling, heightened awareness, focused. Beta, you start going towards stress, tension, anxiety. So this is how we have characterized. We have made the zones in brain mapping. Right? So physiotherapists don't treat a sportsman from outside physically. Now we can treat them mentally also. And I always say a tongue can lie, a brain cannot. So get into the brain, try to find out what the brain is saying. So the brainwave pattern of various sportsmen studied showed that alpha was the best zone, right? And they were in a peak performance. When the sportsmen did not perform well, they were in beta or gamma zone. That is almost, you could say, from 15 to 40 hertz. So physiotherapists today not only prevent or treat injuries, but can also prepare the sportsman to be in alpha state for his or her performance. This is what the peak performance is, the slide. Sorry, I could not get a video. If I trying to get a video for you all to show how a brain mapping is done. Yeah. Again, this is a mix, injured sportsman showing a mixed pattern, beta and gamma. So we have alpha therapy that we talk to the patient how to, right? We can enhance the healing, enhance the concentration and focus. And one of the best way is you can know it's going to be through meditation. I always say that when you pray, you are talking to God, but when you are meditating, God is talking to you. Right? So please learn the different techniques of meditation. Right? Again, see a mix. There's a case study I'm doing of a cricketer. He was an opening bowler. So when we first took his brain mapping, this is how mix, right? And after an alpha session, you see that he took week 1, 4 wickets for 52, then 3 wickets, 2 wickets, and then 6 wickets. So only getting him into alpha zone. So brain mapping is going to be the next generation food for thought for physiotherapists. So many would be wanting to do that. Sports medicine has a price to pay. And earlier we were on, our idea was ice, that is applying ice, compression and elevation. Right? There was ice. We added R to it, rest became in before 2000. And after 2000, we thought sports medicine has a price to pay. And we add P, which is prevention. It's more important to prevent. So we say that cure is a whisper of past, but to prevent is a divine voice of today. We all know how to treat, but we should also learn how to prevent. Yes. And I believe that one who heals one of my human being has healed my mankind. I've taken this quote from Holy Quran, Surah Maida, verse 32. So we all are into a healing profession, all the physiotherapists. So think of healing human being. So you have healed the mankind. You have to heal one. That's the promise given to us. Thank you. I'm open to the questions now.
Thank you very much, sir. It was a wonderful presentation and we learned a lot from it. Thank you, sir, so much. Friends, if you are having any questions, you can write in the chat box. We will directly ask to Dr. Ali, sir. Sir, few questions are there. Shall I take those questions, sir?
Yeah. Go ahead.
Sir, Dr. Subodh Desai, very renowned physiotherapist from Surat, and you're very good friend.
Subodh bhai, if you hear me, hi. Subodh bhai, we miss you.
Yes, sir. Sir, definitely he is listening to you. He has put a lot of comments, and yes. One of the question is, sir, about the brain mapping. That what is the validity and authenticity of the brain mapping, sir? Can you elaborate about it, sir?
Sir, we have been working with the neurologists who are doing EEG. We are at a very tender level now. We are trying to prove. First, we proved the zones. Right? The zones have been accepted by the neurologists. They also have something similar zone. They define it different. We have made it in a better way. We take the average, and that's why the mushrooms are coming. It's an animated way of showing it in a better way. And I think so, sir. I remember Modi sir, Chandrakant Modi sir was in Bombay. And I'm talking a few years back, and we had done on him. We took him to a gamma zone. Then we asked him to meditate, and he immediately came to alpha zone. Yes, we still need a lot of work to be done to get the validity of it. Papers would be coming by my PhD students and MPT students. So maybe gradually we will be able to prove it.
Sir, apart from meditation, are there any ways to train the brain?
Yeah, the coaches can, even the coach's voice sometimes does it. Then there are few sounds. Some people feel listening to a particular sound, they get charged up. So we have to see different things. There are different methods. Maybe you get a phone call from somebody and you may go in alpha. and irritated somebody calling you, you may straight go in gamma. So we are trying to find a right sound. So maybe our phone bells will ring that way. We should be in alpha. Our doorbells, if that sound we find out and identify, there are certain echoes. If we put it as a doorbell, so when it rings, we won't get irritated. We'll go in alpha zone. Or maybe somebody will come with a tablet, then you go in alpha zone. So maybe the pharmaceutical will work on that angle.
And sir, what about the hypnotism and relieving the stress of a sportsman, whether it is helpful technique or not,
It
sir?
has. I have done. Why only relaxing them? You can suggest them. We had
Mm,
done to Hirwani in Sharjah, and
mm,
after hypnotism, we just told him, "Okay, you are going to take 4 wickets tomorrow. Minimum 4 wickets you should take." So he
mm,
actually took 3 wickets. So we were
mm,
again put him there, and he said, "No, I have taken 4." Then we realized that one of the thing was not given by the empire. So
mm,
hypnotism has a plus point and has a minus point.
mm,
Either your order is too tall, you ask him to take 6 wickets and he cannot,
mm,
right? So he goes under stress. And suppose
mm,
you say 2 wickets. So, but after two, then he won't take. Maybe you had a capability of taking 6 wickets. So it has
mm.
a plus and minus point to hypnotize the sports person.
Yeah, sir, even I remember that during the World Cup, Virat Kohli was narrating about the suggestion therapy and all, and he
Yeah,
was
same. It
briefing
is
that.
same. Suggestion is
Yes, sir.
under hypnosis, you give them suggestions.
Yes, sir. Fantastic. So, sir, Dr. Tarpan, sir, is asking you that any tips and exercises for marathon runners and bicyclists, sir?
It's a whole topic by itself, marathon runners. Off season, what they will train. I was talking about off season. Then during the training, at least once a week, they should do. I'm not saying full marathon, but they should do 8 to 10 kilometers regularly to keep in shape, to keep the engine tuned. Good nutrition helps. Good carbohydrate before they start. So usually marathon runners stop their protein almost 3 to 4 days before the marathon. It's a very simple test done by the physiotherapist. Taking 1 week, one week, may they first 3 days give them protein, then they stop protein, give them carbs, and make the marathon runner they perform like that better. Two, simple study done on treadmill at college level. So get 3 people, make them run. So some runs for 25 minutes, somebody's run for 20 minutes, whatever. When they're tired, they raise the hand. But change the diet from that moment. You put one on fat, one on carbohydrate, one on high carb, one on high protein. So next day, same time when they are running, the one who was on carbs runs more and better because
Hmm.
he has used the right fuel. The one who
Right.
was on fat, the fat to get converted into carbs and come, it was taking time. So studies are many studies. That's why I'm very sure carbs is the fuel. So when you are running a petrol scooter or car and you put kerosene in it, it will go, but there'll be a lot of jerky moments. So I'm not saying that if you have protein or fat, you won't run or you won't play. There will be jerky moments. You won't be having that right fuel that your body needs.
Hmm. Right, sir. Sir, can you tell us about the whey protein? Because many
I'm
sports persons.
against anything natural. I'm against. We have a lot of is it sold usually by trainers because they
Yes, sir.
get a high commission. I'm against it. Use it. Google and find it on the natural way. White of
Yes,
eggs, even if you're not having eggs in vegetarian, there are many options. Drumstick is high in vitamin D.
yes, sir.
Senga, what we call it, we put it in dal and sambar. Very high.
Hmm. True. Very, very
Especially
true.
for Corona, also I advise them to take drumsticks. Soup or dal form, sambar form, whatever.
Sir, you are having wonderful knowledge regarding the corona and how to take care during this. Sir, I would like that once we organize a lecture on this topic as well, because it's a unique information which you share on the corona
It
and
has come to stay. It's
yes,
like
sir.
any other virus, come to stay. I'm 2.5 months working in a Corona hospital. Nanavati hospital is COVID-19 hospital. We have
Yes, sir.
130 patients. We go,
Yes.
we treat them. But I have not thought I should wear gloves and this. Of course, I wear my gloves, I wear my shield, I wear my mask. But I depend more on my immunity. I've immune myself. Good vitamin C, vitamin D, haldi doodh, grandmother's recipe at night. Have haldi doodh, adrak wali chai, hot water sips. If you see, my hot water is ready, always there. So
Wow.
every year I sip. So I'm ready to fight. All of you all
Fantastic.
should do that. I always say when a people that when you are scared that through your window somebody will come in, you put a grill outside to be safe.
Yes.
So if a virus has come, let us. Nothing fights better than our body.
True.
Immune your body.
Wonderful. Sir, I'll request you, we will organize a specific lecture over the corona and
No
all.
problem.
It will be
Next
a
week.
great help. Yes, next week, sir. Thank you, sir. Sir, there are a few other questions. Sir, one question is regarding the tennis elbow. Sportsmen face a lot of tennis elbow problems. Sir, what is your advice about the tennis elbow? If to prevent it, and if they are getting it, how to manage it, sir?
To prevent this grip, again to manage it, change the grip. You have to check the grip. Then treatment wise, a lot of I see. I'll overall tell what is happening. We get up in the morning, we brush our teeth, see our elbow. Then we are preparing, we are working, we are fiddling with the phone, elbows are bent. When you walk, is your elbow extended? No, there is at least 5 degrees flexion of your elbow. And we sleep. So in the whole day, when has this elbow got full extension? For that, Surya Namaskar was made. Pranayam. Up so that your elbow gets straight. So I show the exercises on the wall, push the wall in all directions, all 4 directions. Push
Hmm.
it, elbow straight. That's one of the things. Crumbling of newspaper for the patients. And there is a mobilization where we give a jerk to the elbow, right, to get the full extension. Many people just get all right with that. If you get the click.
Wonderful. Sir, one of your dear student
Hey,
and
Dipti, my student Dipti, my all Surat gang. I call her Madu. Hi.
yes,
I have
sir.
many from Surat. I've got many interns.
Yes, sir.
Many from Surat.
And sir, they all are so wonderful physios. Once they get training under you, I really respect that.
I
Dipti and
believe
me
to make
was
champions. I
yes, sir.
believe only to produce champions.
And you make also, sir. That is wonderful. Sir, Dipti is having one question. That what about the vital capacity in athletes, sir? Can you?
Very, very important. Thank you, Dipti, for reminding me of that. I've been working on this vital capacity, telling Indians have it less than 2 liters when you breathe out, and I blame the government because there is no tax on breathing. So if you check randomly any college, just catch people on the road and do a spirometer test. Here with you. I want students to do. Our students have done many tests. See, this is when you pull it, it's only 2.5 liters. But this 2.5 liters, 80% of Indians won't do. Girls, especially, are below 1.5 liter. Males maybe touch 2 liters. And the lung can take 4.5 liters. Right? So today we will tell them the test how to, right? Even for checking corona, I say people take a deep breath, hold it for the count of 15. Count within yourself. Right? If you don't cough and you don't feel breathless, you are fine. So do it twice a day and make your parents do it on your parents also. Is one. Now, how to increase the vital capacity? Please, one, not when you are sitting in rickshaw to take all the fumes, right? When there is fresh air, especially the morning air, so take a deep breath, and you are going to come out the way I do it through a hissing sound.
Yes. Yeah.
4 liters. So please practice 8 to 10 times in the morning. You can do it.
Wonderful, sir. Sir,
Vital capacities are low, and it's very, very important. Corona attacks the lung, so increase your vital capacity.
fantastic. So Dr. Sapna Makwana is asking that what should we keep in mind for athletes training after Corona outbreak as a sports physio?
Again, good vital capacity, good immunity to them, and gradually increase their endurance, because their endurance must have dropped. Check their weight, they must have increased the weight, I'm very sure. They've been only sitting home and eating, not doing anything much.
So one of the doctor is asking that, so Dr. Ishani is there. No, he is asking that how we train according to alpha, beta, gamma waves.
But naturally, I would go for only training them for alpha. I wouldn't want them to be any other thing. Put your enemies in gamma, right? But if you want good products, we are also trying to do a study to take 10 best surgeons and see when they're operating whether their brain is in alpha or not, or maybe in which it is. So we could ask people to go, maybe 10 good MDs of a big company, and we want big, good brains to check their brains and find out, and then divert people to go to that zone.
Fantastic. Sir, Dr. Vijay Kumar, he is a football team physio from Chennai, Dr. Vijayan. Sir, he is asking that how we can train the players under 13 and 16 years of age without affecting when they tested for age verification.
How to train from 13? You have, see, it's a grassroots level. So you start increasing one. I feel once a week at least swimming should be part of it. Swimming, good nutrition. Put them on the right nutrition so that they grow well. Good protein. I prefer protein always in the evening. So when you are resting. So during the training, morning and all that carbs, afternoon carbs, but evening should be good protein level. Work on the height so that according to the age they are getting the height. Evaluate the muscle strength, especially quadriceps, adductors, abductors, both. Usually in footballers, we only concentrate on the quadriceps. No, we have an abductors, and adductors have a very major role. One of my PhD students is doing a study on footballers. So we have found out by strengthening the abductors and adductors how their performance has improved. And most of them will be less in vitamin D3 and B12. So I would advise Vijay to at least once in 6 months do checkup of the vitamin D3, B12, and magnesium. Nowadays, magnesium plays a very important role in aches and pain.
So he's also asking about the weight training to this young guys.
Yeah, less weight, more repetition.
Fine.
For age, if they are below 18, they can do weight training, but a little less weight and increase the repetition.
So Dr. Jatin Makwana is asking that what is the difference in the role of strength and conditioning coach and physiotherapist in terms of training of athletes, sir?
See, all different. Somebody has specialized only in training, right? There are athletic training. They must have done their PhD in physical training and physical training schools, right? We as a physiotherapist more are into treatment, but maybe because of our post-graduation, because of our MPT or PhD, we have gone a passion for sports. So I don't find a good physiotherapist can be a good coach also. Coach in physical training, not the game. For the game, we had one coach for a team, but now if you see the same team has got a bowling coach separate, fielding coach separate, batting coach separate. The coaches again get subdivided into the specialty. So I don't think so we'll be able to do everything, but most of the team now have a physiotherapist for the treatment side, and they have their own physical training coach. So you can do both. It's not that you can't.
Christy Johnson is asking that can you suggest any good university where masters in sports is advisable to do?
I should not say, because I still feel my university is the best. NMIMS. We give in musculoskeleton. Yeah, but because our students are regularly with the sports team in Bombay. But JNDU, I won't mind naming. JNDU, Guru Nanak Dev University, Amritsar. They are totally sports. It's nothing else but sports.
Fantastic.
Because that university has a lot of sports team. Every sports, they even have swimming. Everything is there. Those who are from Pune, Sancheti, because Sancheti is attached to Balewadi. Gujarat, I don't know really in Gujarat if anybody is into total sports.
Sir, Divyesh Nakrani is asking about how we can doing meditation for alpha zone at home during this stressful time.
See, I would only guarantee you if you're doing any meditation, automatically you fall under alpha zone because you focus. Meditation, when you're focusing is alpha zone. You relax. Now, a little more than that, then you are falling into theta and delta, which you are relaxing, you may fall asleep. So then you are not in alpha, you are minus alpha, going downwards.
Sir, Dr. Abani is asking from Pune is that sometimes ordinary people get tennis elbow problem at the age of 75 years. Very painful. Please talk about it. Sir, I think
Again, I
you have
said
also.
lot of extension exercises, extension of your elbow, crumbling of newspaper with the hand straight. You can crumble a newspaper, half a newspaper, then full newspaper. Apply ice, strengthen the brachioradialis, stretches over the wall, will solve your problem. And see if you are using any grip. Maybe the cause is a grip, so the grip has to be changed.
Sir, Heli Shah is asking that any article available for brain mapping.
There are many of my students who have presented the MPT thesis on that. But if you Google, there may be many people doing it. We are doing it in a different way. We've got it for sports people first. Then we tried it on two neurological conditions in hemiplegia. And it helped us getting the patient focus on alpha. They take treatment better once they're in alpha.
Wonderful, sir. Sargam Setia is asking that, sir, does warm up and cool down affects the lactate in the body?
Yes, I always feel half the time, if you are warming up for 40 minutes, 20 minutes should be your cooling down time. Always have the cool down I do the cool down on the floor, more of yoga, asanas and all that in cooling down. And for warming up, standing up exercises, stretching, all that I do, whatever the sports would be.
Fantastic. Sir, Dr. Kapasi Aparna is asking that she is a physiotherapist and working with the fitness industry, a gym. Are there any certified courses for fitness training which will useful in both India and abroad as well?
There are many, but I don't know. It's all depends who will accept it. Talwarkar also does it regularly. There are many courses. There are online courses also. But as far as the university wise, you have to do your master's program and you can select that as a subject of training in the gym or fitness industry.
Sir, Bhavesh Pamnani is asking that can we train an athlete to prevent injuries through this technique? Sir,
Yeah.
Sir, yeah.
See, I said off season, if you're training a person for a new technique, see which muscles are involved. See that good stretch and a good strength is given to that muscle.
Sir, as far as prevention is concerned, what is the role of the proprioceptive training and the prevention of the injuries of the sportsman?
See, whoever are into sports medicine, I want all the physiotherapists to know the game well. I remember when our kabaddi player and kho players were going to South Africa for treatment, they've never seen it also. The South African doctor never knew about it, how it is played. So you should know the rule of the game. So knowing the rule of the game, then find out which position that player plays. Suppose if it is a cricket, he's a fast bowler. So fast bowler can even get a hamstring stretch, even a quad tear, even a shoulder. So seeing the game, what they perform, the role in the game, and then strengthen them, stretch them, explain them how to do their own warming up, stretching, and cooling down. It helps.
Yeah. And so Vijay Kumar is also asking that the coach from Chennai, Dr. Vijay Kumar, is asking about the energy drink consumption during and after the training, sir.
I feel our limbu pani salt is the best. Or chas, if you're having buttermilk with things, chas, because Chennai is a humid place. So they will be losing a lot of salt through training. But I don't advise anything, sports drinks and other things.
Fine. Sir, Asha Patel is asking about a quotation behind you. Some quotation.
I see. Can you see?
Yes, sir. Fantastic. Thank
If
you,
I
sir.
was organized, I would be dangerous. So it shows so shabby room, all my things behind. So I'm not organized. Asha, I'm not organized. Okay.
So that actually a sign of a creative person, actually, if you
Okay.
are unorganized. Sir, Dakshya Sai is asking about the back pain in cycling, sir. How to reduce it?
I feel because they do a lot of flexion, simple exercise, extension, lie on your stomach, put a pillow under your chest. This half an hour morning, evening. They have to unwind. Cyclists usually don't unwind. They're always in flexion. So the home exercise, not even on this thing. There is a simple. Can I show? Wow. I'll show it quickly. Let's come and hold now, Manju. That's the bolster. Bolster. Right. See this. A pillow, bolster under the chest. You can be like that. Watch television, play on your mobile, play on your laptop, whatever you want. At least half an hour. You unwind. So
Wow.
cyclists usually should unwind half an hour morning and night.
Wow. That's wonderful, sir. Your enthusiasm to guide people and to be helpful, that is really commendable, sir. At this higher level, you are so down to earth and so humble to all of us. That is fantastic, sir. We really appreciate this humbleness. This is phenomenal, sir.
Because Dipti knows I worked in a canteen, hospital canteen. I used to work first in the canteen. I'm a
Yeah.
canteen boy.
Okay.
Did my studies, yeah.
Sir, Mr. CK, he is asking that we know that during matches, Virendra Sehwag was singing songs in on the ground. Sir, whether it is helpful to maintain the alpha zone, this kind of things, sir?
Yes. See, when you want to put a person in gamma zone, if you remember, the Pakistanis used to always abuse us. Even West Indies and Australians, they used to abuse. So it puts you to the gamma zone. So now we train our boys, sing, be in your own world, whatever you want, think that so that you remain in alpha.
Sir,
It's a
Subodh
way
Bhai,
how to different techniques you have to use to keep yourself in alpha.
so Subodh Bhai is telling that you are branding the vital capacity. So there is no tax right now. If Modi will listen, then he will start taxing on the air also.
500 rupees a month. And then Indians will be breathing. They have paisa vasool karega 500 rupees deta hai.
So
But I'm
Christy,
still waiting from Surat to hear. I heard Surat is the capital of galis. Lovely galis come out from Surat.
yes, sir. Sir, Christy is asking about the importance of aerobic exercises in sports.
Again, it's for endurance. Aerobic can be done. I used to take my boys once a week to swimming pool. Just to play in the pool. Or aerobic dance. I used to put up music, whichever they love, and they had to non-stop dance. So first we started with 10-minute non-stop, then give a break, then made it 15 minutes. We used to increase it, then it was not half an hour non-stop.
So Dr. Komal Varot is asking that if a player is in cricket, while throwing the ball, they get a sudden pain in the shoulder. What is the immediate treatment, sir?
Oh, I have brought back the shoulder dislocation on field. There's a technique for it. You have to pull the shoulder downwards and leave it. It goes back to the place. It's like this. It comes out. So when you pull it down, it's like this, but goes back straight to the place.
Hmm.
But you can't. If the person can, you have to first find out it is not shoulder dislocation. If it is there, you have to put it back. If you can't, you don't succeed, take him to the hospital, do an X-ray, and put it back. The orthopedic surgeons will put it back. Then strengthen it. We have to do a lot of band exercises to strengthen it so so that it doesn't come back again.
Sir, Suman Shyam from Bhopal, uh, Salem, doctor is asking that my question is to you is about the athlete performing wrong techniques while fitness regime, for example, kneeling on medicine ball, chest press.
See, any technique that is wrong, if they are going to keep practicing that, more chances of injury. You have to correct them. See, when I joined way back with the Indian cricket team, the warming up was the batsman is to knock. People is to throw a ball, they should knock. And the bowlers is to bowl at a wall. So we had to change the whole idea. There's a warming up process, there is a stretching process, you will perform better. So you have to explain them. Many people still don't take it so easily.
Sir, Syed Anwar is asking that you look so fit and enthusiastic. How you keep yourself fit, sir?
I don't know. I work the whole day. That's what I know. But no, I don't go to gym. But whenever an opportunity comes, I love swimming. Swimming is one of the best exercise. I've never got a swimmer as my patient. Not for neck problem, back problem, nothing.
Wow, wonderful.
And good diet. I am very careful of my eatings.
Fantastic. Sir, Dev Singh is asking about which exercise is good for endurance, long distance running or swimming?
Both. If you're training, it should be both. So if you're swimming one day, run the other day. Because there's a lot of resistance, the buoyancy law, the water resistance when you are swimming.
So Dr. Riddhi Mistry is asking, what is the accurate way to measure the strength and flexibility in sports person?
No, it all depends on the sports. For a weightlifter, I will ask you, last year lifted was 200 kg. So I want him to lift something more. So depending what you are looking at, you have to go a little grade up. If a person can exercise for 35 minutes non-stop running on a treadmill, of course, I'll be expecting him to do 36 minutes then. Measurement is not there. There is a thermometer to put and find out. Right. So it is, if it is to do with weightlifting, we see the number of weight and repetition the sportsman can do.
So Pinakin Ravalji is asking about which is the good diet you would like to advise for 400-meter athlete?
I'd say proteins at night, and from day morning he starts, it's carbohydrate. Good training. Yes, now 12:30. I have to go.
Yes, sir. Sir, last one question. Shall I take, sir?
Yeah.
Yeah. So this is from Suraj Rawat. How good is the platelet-rich plasma therapy in
I've done it on many sportsmen. It helps. PRP helps. The pain goes away. It's better than doing the surgery.
Fantastic.
It's an alternative before surgery, especially in meniscus tear. If you're not sure it's a tear, plasma PRP is given and we get good results. Even SRK has done plasma for the knee.
Okay. Nice.
Dr. Daftari had given.
Yeah. It's wonderful, sir. It's 1.5 hours. And thank you so much, sir. So many questions are still pending, and I think if I will take all of them, then it will take more an hour of time. Sir, we'll definitely take other questions next time. Sir, it was a wonderful time with you and fantastic information. We didn't know how the time passed. It is fantastic, very informative, and we really thoroughly enjoyed everyone. All the viewers are also, they have thoroughly enjoyed the entire session. And still at the end of the session also, there are more than 150 viewers are watching right now, sir. So we are so much thankful to you, sir. Thank you very much.
Only pray that, only say for the physios, may God give you all a healing hand. My big hi and namaskar to Subodh Bhai, if he's still there. And all my students were there, especially my Madu, Dipti, who is from Surat. There are many from Surat and Navsari. God bless you all and all the best, Niraj. Thank you.
Thank you very much.
Me.
Thanks, sir. Thanks.